I am Santisha Walker, your nurse advocate. I am a healthcare professional serving as a registered nurse and a certified wellness coach. Today, I would like to focus on informed consent, which is one of your many patient rights. Now, I'm choosing to focus on the specific topic of informed consent because it is extremely important that you grasp the concept of what informed consent is. According to the National Institutes of Health, informed consent is the process in which a healthcare provider educates about the risks, benefits, and alternatives given for a particular procedure or intervention. Now, the patient must be competent enough in order to make an informed decision whether or not that procedure or intervention is the best option for them. So it is essential that you actually understand the information that is being provided to you so that you can make the best medical decision for yourself. Now, again, whenever a procedure or treatment, including the start of a medication, is planned to be implemented on your behalf, it is extremely important that you understand the risks, benefits, consequences, and alternatives to that particular intervention, medication, or procedure. Now, a healthcare provider, which could be physician, practitioner, specialist, or surgeon, should never proceed with an intervention without discussing those risks, benefits, consequences, or alternatives for that procedure or treatment. And again, that includes medication. You have a right as a healthcare consumer to know this information so that you can make the best healthcare decision for your personal care. Now, in the same instance, you also have a responsibility to hold these healthcare providers accountable to providing and disclosing this specific information. It is your right and responsibility to do your part and to help yourself make the best medical decision for your actual health. So you can do this by putting necessary measures in place to help prevent malpractice. Malpractice simply means causing harm or injury through negligence, which is carelessness, improper practice, or through omission, which is basically leaving something undone. You can also establish a living will or healthcare power of attorney. And so this basically has someone that can speak up on your behalf if you become what's considered incapacitated or debilitated, which means you are unable to make healthcare decisions on your own due to a medical condition, due to declining health, or due to mental instability. Now, these are just two ways to ensure that your patient rights are protected. In essence, I want you to understand the value of comprehending your risk, benefits, alternatives, consequences to any healthcare decision that you're making. And so it is important to have that conversation with your healthcare provider, which again could be physician, could be practitioner, could be surgeon, could be specialist, about the specific intervention, the treatment, the medication, the procedure that is being presented to you, okay? But you have to take responsibility and prepare to have that conversation just in case that information is not presented to you by your healthcare provider, okay? So now you know to look for those risks, benefits, consequences, and alternatives anytime anything new, procedure, treatment, medication, any kind of intervention is being presented to you by your healthcare provider. To find out more about informed consent, visit the U.S. Department of Health and Human Services, hhs.gov, and search informed consent. Remember, knowing how to advocate for yourself leads to better health outcomes and a higher quality of life because you're actually able to make well-informed decisions. To help you prepare to better advocate and gain confidence as you communicate with your medical care team, there are resources available to you that you can tap into on demand at any time whenever needed. On the channel's homepage, click the link in the banner entitled Access Health Advocacy Guide, or you can visit santishawalker.com/books to grab a copy of the Advocacy ebook and guide. Now, I want you to take responsibility and affirm to yourself, I am taking responsibility to receive informed consent before making medical decisions. Then prepare, plan, and execute. Stay tuned and be sure to hit the subscribe button to stay in the loop when new advocacy videos are being released. Let's continue to gain clarity. Let's continue to advocate for our total health and wellness. I believe in you. Until next time, stay well. Bye-bye.